Okay, thank you everybody for joining for the Injury Prevention Plus Seek Action Period Call number 3. I'm excited to have another jam-packed agenda full of wonderful educational information. I will continue to admit people as they come in, but I want to get started so we have enough time. Thank you as always to ODH, the VIPS section, for making this possible. And overview of our agenda today. Welcome everybody. I'll ask to take attendance in the chat. Zainab will have a nice data summary for us. 2 presentations today around job resources and food insecurity, 2 very important topics that we cover in this program. If there's time, we'll talk a little bit about QI, reminders, another reminder for the annual meeting, and any questions that you have. Okay. Please share in the chat your name, your role, your organization, and your county. I see that people have started doing this already, and I appreciate it very much. And Zainab, you are on deck. I have your slides.
Great, thanks, Brooke. And so I have a few slides that I have prepared for today. It's not going to be practice specific, so it's going to be just a combination of all the data that we've received so far. Of course, we do create these tables for each practice, and on our one-on-one calls with Brooke and I and you, we do discuss that, and we talk to you about any issues that you've possibly been having or any data that looks like that would need a little bit of work. So if you do want to look at your data specific to your practice, please reach out to Brooke and she can schedule a meeting with the 3 of us, and we can definitely go over that with you. So I'm ready for the first slide. And so we've been really trying to increase the number of families that are receiving resources, whether it's our resources that we provided to you, like the handout that is AAP specific, or if you have any handouts that that you've created as a practice, or if you have, for example, car seat handouts that kind of give information to the families on how to install car seats properly, or who they can go to kind of check that for them. We are very open in terms of what could count as a resource. So that's very good on your part, that any kind of resource that you provide for them is, that you provided resources, period. So here we have 2 lines. The blue one, which is a little bit under the red one, represents birth to 12 months. And then the red line represents individuals or families with children from 13 months to 5 years. We have September data and October data, as you can see in the bottom chart. We have had a 10% increase in resources given from September to October. October data looks very good. So just to put it out there, this data that is included in the chart only goes through October 19th. So anything submitted after that, it has not been included here. So that's just something to keep in mind as we go through the slides. And so we can see here in October, the younger age group, the birth to 12 months, has a 95% of families that have been receiving resources, and then the older group, 96% of the families have received resources. So that's very great data. We hope to, possibly potentially increase that to 100, or at least keep it around there at that high percentage. So, I just want to tell you guys that you've been doing a good job, especially with the resources provided. So I'm ready for the next slide. And here you can see, the different topics. And so again, this is topics addressed for the younger age group, birth to 12 months. And you can see that September and October data are included. And again, October data only goes through the 19th. In terms of home safety, which is the light blue, practices altogether have had a significant increase in in topics being addressed. So for example, if the family indicates that that they're having an issue with one of the questions that are part of that topic, once those questions are addressed, then that increases that topic addressed. And so there has been a significant increase from September to October, which is great. We also had an increase in safe sleep and car seat safety. So really, what I really wanted to discuss with the group, what we did see in September was that a few of the questions within the home safety were not being discussed as often as we would all hope. And so those three topics were CPR certification, securing furniture. So we know that some furniture sometimes needs to be secured to the wall in order to prevent, potential tipping over or potential falling. And then choking risks, among children, like if you have something lying around that your kid could potentially reach and potentially choke on. And so those three questions were really discussed less than 50% of the time among most of the practices. And so we've seen that increase in October, which is great. And I know Brooke wanted to, talk about, CPR certification and all these things that that could be, considered that you discussed it, even though you might not think that you did. So I know Brooke is going to go over that as well. And so in October specifically, we saw a significant increase in the discussions of CPR certification. So that's great. And so this data again represents all the families with children from birth to 12 months of age. And I'm ready for the next slide. And this is pretty much the same, but just for the older age group. For the older age group from 13 months to 5 years, we don't ask questions on safe sleep. And so here again, we can see a significant increase in home safety. As you can see in September, home safety had the lowest percent of discussion, or the lowest rate of discussion among families. And in October, that we did see an increase there, which is great. And we hope to, keep that trend moving upward, or at least, keep it pretty close to that 90%. Hopefully 100% by the end of the project. And so again, here in the older age group in September, we saw the data showed that CPR certification and securing furniture were the two questions within the home safety topic that were least discussed. But we did see that that increase in October. And one thing that I've seen among most of the practices is that in October there was 100% discussion rate for safe installation of car seats. So they ask a question like, "Hey, has your car seat been checked by a nurse or a firefighter or someone?" 100% of the practices, or 100% of the families that indicated that that topic needed to be discussed was discussed by the physician. So I was really pleasantly surprised by that. And so, this data, again, we're going to keep looking at this data as we move forward in the project, and we're hoping to keep these discussion rates pretty high, like they are right now, potentially higher. For family needs, car seat safety, and home safety. But again, you guys are doing pretty well for the beginning of the project, and we hope to see that these numbers continue to increase and have an upward trend. So that's all I had prepared for today. I'm not sure if any of you have any questions, or if you want to look at data specific to your practice, we can definitely send that to you, or we can have a discussion if you would like. So Brooke, that's the end of my slide. So if anyone has any questions, I'm open to questions, or you can put them in the chat and I can answer them there as well.
Yes, Zainab, thank you so much. Yeah, if you have any questions, please reach out. I wanted to touch on the home safety data that we talked about last week. I was able to pull the top 4 topics that we talked about and put more information in last Friday's Seek check-in email. Just a reminder that there is online CPR certification and AAP link to secured furniture and choking risks, mitigation of that. So hopefully those links in the email, you found those helpful. But if you need additional information on the home safety topics that may be harder to reach, we can absolutely discuss that. Thanks, Zainab.
Great, thanks.
Okay. Next, we have Amy, a project manager from the Office of Workforce Development. I'm going to touch on the job resources that are available in Ohio. She's from the Ohio Department of Job and Family Services. And Amy, I have your slides.
Well, thank you for having me. Like Brooke said, my name is Amy Dumbaugh. I work for the Office of Workforce Development. So our office helps, basically helps people get jobs. So we have different programs that will help individuals get back to work or find employment. One of the things that we have in our office is the OhioMeansJobs.com website. The OhioMeansJobs.com website is basically kind of a resource that has not only a place to find jobs, but resources for students and for adults that can get them to their next job or get them to some education to get to their next job. So we're just kind of trying to help them in any way that we can to gain employment and get their training that they need. So if you could go to the next slide. We have 88 Ohio Means Jobs centers. So we have OhioMeansJobs.com, the website, but we also have Ohio Means Jobs centers throughout the state. There are 88 centers throughout the state, one in every county. We used to have a couple in Cleveland. Unfortunately, they consolidate. Well, fortunately, unfortunately, they consolidated, and so there's just one now. But there are 88, so you can find one in every county. And you can go to the OhioMeansJobs.com website to find a center near you or find the center that is near you. If you go to the next slide. There are, like I said, 88 throughout the state. The services that they provide are access to computers. So kind of like the libraries have access to computers, we have access to computers, internet, phones, copiers. It is a place where you can make a connection to the unemployment office. Some of the counties have a direct line, or they'll have kind of different resources. Not all of them have a direct line, but some of them do. And then that's kind of based on the area as well. But they also provide workshops on interviewing, job search, resume, basic computer skills. They provide career counseling, veteran services, adult education classes, occupational skills training, networking opportunities, and community events like job fairs, career fairs, that kind of thing. So we do have a lot going on at the Ohio Means Job Centers. If you want to go to the next slide. We also are in charge of the Workforce Investment and Opportunity Act. You can find that at most Ohio Means Job Centers. And that's just to help adults and 18 years or older to find employment or get training that they need. So it also provides supportive services. So those kind of wraparound services like transportation, childcare, you can get that through the WIOA program at the local centers. If you go to the next slide. Another program that we have is the Ohio Employment Program for Young Adults, or CCMEP, as some areas like to call it. This program is named differently in almost every county, but what it is it's for young adults 14 through 24, and it's for low-income young adults to help them find employment or find education to get them employment. And again, this is going to be another one of those programs that's kind of giving those wraparound services to, make sure that they have transportation, make sure that they have childcare, any coaching or tutoring that they need, anything that can prepare them to have a job or keep a job or be able to go to school and maintain that kind of flow. So if you want to go to the next slide. So those are the services that we have at the center. On the Ohio Means Jobs on the OhioMeansJobs.com website, we also have self-service activities. So when you think Ohio Means Jobs, you're going to think job search. So we have on our job search, obviously it's just like a standard job search. We're powered by monster.com. So it's it might look same or similar to Monster information, but our services are all free for employers and for obviously job seekers, and you can filter on most anything that you need to. A couple extra things that we have on our site, there is a connection to LinkedIn. So if an individual is logged into LinkedIn at the same time they're logging into their Ohio Meets Jobs account, it will make the connections. If they know somebody in a company that is, they know the person on LinkedIn, but the person works at, say, whatever company, it will say, hey, do you know this person at this company? And so that you can kind of network and make that connection. So that is an extra little thing that we have. We also have we kind of link all of our job postings to the WorkKeys scores, where WorkKeys is kind of like, it's kind of like a ACT, but it's more for employers to kind of gain an idea of actual skills that an individual has. So we map all of our job postings to WorkKey scores as well. We pull in, it's an indexing site, so we pull in from different websites. We pull in from Monster, we pull in from Career Builder, we pull in from all these different websites as well. So that's another thing that's on this website that I think is really cool. If you want to go to the next slide. We have this is what I have. There's a lot of really cool tools on Ohio Meets Jobs. This is one of the really great tools that we have. It's an assessment and practice test area. So on Ohio Meets Jobs, you can go in and you can take practice ACT tests, SAT tests, the WorkKeys assessments that I just mentioned. If you have an individual that's, you're talking with them and they have an interest in a career in healthcare or something like that, we have all the practice tests on Ohio Meets Jobs. We also have Microsoft Word, Excel, PowerPoint. So we have basically anything that you want to learn, you can learn on Ohio Meets Jobs. We have a whole student section where if a student is struggling in their math, in their math classes, there's a whole section where they can kind of brush up on their math skills. Or if somebody who hasn't had math in a while and they're getting back into the kind of workforce, because maybe they've just had a kid and they've taken a couple of years off and they want to get back in, but they need to brush up on their Excel or their math skills or whatever. We have all of that information on ohiomeetsjobs.com. So this is a really cool thing. It keeps track of everything. It scores everything. There's a practice, simulator, and learner mode. So the obviously simulation portion simulates the actual test. If it's timed, it'll simulate and cut you off at 60 minutes if it's a 60-minute test. And the learner mode is kind of my favorite because it kind of walks you through each of the questions and it'll tell you the answer if you're right or wrong. And then it'll say, this is why you were right or this is why you were wrong, which I think is really cool for individuals that are learning new skills and things like that. If you want to go to the next slide. We also have assessments on here. This is one of our assessments. It's a work values assessment. So this is really great for students. This is really great for individuals that don't know really what they want to do moving forward in their career or in their life. This is kind of just going to tell them what is important to them in the work environment. So they sort these cards into kind of like the most important to least important, and you get results at the end and it'll match you with occupations based on just your work values. So it's kind of interesting to see what occupations pop up. So that's kind of a nice thing that we have on here. If you want to go to the next slide. We have a career profile and we also have a career cluster inventory. So they're same or similar for students and job seekers, adults. So what this does is the career profile has 60 questions and it's rating things from strongly dislike to strongly like. And you answer those and you just kind of rate however you feel about each statement. And then at the end, it will tell you basically what kind of interest that you have. If you're social, if you're conventional, if you're artistic, it will tell you all of that information. And it will tell you a little description about what that means. It also matches you to occupations through this as well. So it'll tell you, hey, these are the occupations that match with your interests. So you have the work assessment that we just discussed before this one, where it matches occupations to what you work what you value in the workplace, then it matches here for your interest. So if you have things that match for those comparisons, you can kind of make sure that you can kind of narrow down someone's search a little bit, which is kind of nice. So I really like this assessment as well. If you want to go to the next slide. Okay, so we have a budget and lifestyle calculator. So this is really helpful to both adults and students to try to figure out what kind of occupation or what kind of industry they need to go into to live the way that they want to live, or how they live, I guess. If you want to go to the next slide. And we have two different versions. So the first one is the budget calculator. This is one where if you have an individual who could be a student, could be somebody who's on some kind of assistance, they can enter their information in here, their housing information, their utilities, their food, transportation. It goes through everything, and then they can enter the amounts that they have. If they're receiving any kind of supplemental assistance, so if they're receiving HEAP, or if they're receiving, SNAP or TANF funding, they can put all of that information in here. And what it will do is it will say, okay, this is your target salary that you need to get. And it will say, without your supplemental income, it'll say you need to make this. But however, with your supplemental income, you would need to make this. So what we're trying to get individuals to see is, okay, you can be, if you have all these supplemental incomes, like students, or students could have supplemental income by their family, so it would be nice. It's nice for them to see, like, hey, okay, without my parents' help, I need to make this, but with their help, I can make this. And then they can kind of start to see how to get to that next step. How do they get from, what they're making with all the supplemental income, how do they get to that dollar amount that they need to get to without any supplemental income? So this is very good for seeing kind of the bigger picture of what you need to do and how you can get there. It does match you with occupations, again, based on the information that you put in to kind of help get people there. So this is a really great calculator. I love it for that. And then if you go to the next one, this is the lifestyle calculator. So this is more, it's based on where someone lives. So all of the amounts are pre-populated based on the area that you choose. So individuals can go in, and it's the same kind of calculator. So it still has housing, still has utilities, still has food, transportation, and all the rest. But it gives some predetermined amounts. And then you can always create your own, but like you always have that in there to just kind of pick from. So this one's really popular with students because it's a lot of pictures and predefined amounts, which they don't have to try to figure out as a student, which is really great as well. So this is really fun with students as well, because they just are unaware of how much things cost. So this is kind of a nice thing to go through with students, or students to do on their own, just to play around and see what they would get. Again, it matches with occupations and different things like that, and it will break down the costs and give you a little graph about where they're spending the most and that kind of thing. So that's both the calculators are really fun, and I think this is a really good, easy way to get somebody to understand, seeing that bigger picture of, oh, I want to live this way, I need to do this, I need to do these things to get there, so we really, really like these calculators on the site. And if you want to go to the next slide, we have an interviewing tool as well. So this is so the calculators are probably my favorite. And then the assessments and interviews, the assessment tool is really cool. And then the interviews is another one of my favorites, because this is a really good way to really, from start to finish, figure out how to interview. It's very, very difficult to interview. Even people that do it all the time, it's very, very hard to do. So you always need to brush up on your interviewing skills. There's a fast track, which are just videos. So the fast track and kind of the mastery track, those are just videos that you go through, and you just kind of hear somebody talking about, your elevator pitch, or how to answer specific questions. And it's just little videos that you can watch. So if you're kind of more of a visual learner, then you can take that in and it's really good. If you go to the next slide, there are lots of different other ways to kind of create answers to questions or practice answering questions. If you have a webcam, like our Ohio Meets Job Centers have webcams in some of the resource rooms. And then also in the library, some libraries have webcams as well. So individual students or job seekers, whoever, can go in and actually practice answering questions. And the way that they practice answering is you hit play on whatever question you want it to ask you, and then you hit record to record yourself answering that question. And the really cool thing about it is you watch it back and you can kind of see, how often you use your hands or how often you say or, the different things like that typically everybody does. Then you also can send that video to whoever you want. You can send it to your career counselor. You can send it to your parents. You can send it to just your friend to see, hey, can you just see how I answered this question? See if you think I did okay, or if I need to add anything to it. So those are really cool things. And again, Ohio Meets Jobs keeps all this in their profile. So it's all maintained in one area. So this is a really cool thing. It'll ask questions about just general questions. There is one on here that's for admissions. So if you have individuals that are going to different graduate schools or any school that has an admissions interview, there's an admissions interview on here. There's by industry, competency, pretty much anything. But this is a really good tool that I really like to use. I'm going to go to the next slide. And the last thing on the interviewing tool, and I'll move on after this, but there's, like I said, you can go to any of these questions. And what I really like about it is no matter what kind of learner somebody is, they can find out how to help them be a better interviewer or interviewee, I guess. So for the general, you see the career change, entry level, internships, managerial roles, mid-level. And then if you click on why you're like any kind of question, you can say, why are you interested in working for this company? It will tell you what the interviewer is looking for in answering that question. And then it'll give you an example answer so that you can fit your answer into kind of that mold. So you can always have a great answer to questions. So, and then it gives you the option to actually practice those questions. So I just find this tool really, really useful. And I think it's really easy to use. So it's one of the great things on our site. I'm going to go to the next. And then our resume tool. So we do, obviously, like every other job search website on here that we have, you have an area to keep your resume. So your resumes, you can have up to 5. We only let 1 be active. But when you do make a resume active, we have a way to pull skills from your resume. And you can see where mine says you can select up to 20 skills, and I apparently only have 2 skills. So project and program management and people management. So it's not really a great example, but you can pick the skills that you are interested in, and it'll match jobs to whatever you pick. So it's kind of doing another one of those matches for you, so that it's kind of an easy way to pull that information. But it's a really cool feature if you have all these different skills and you're like, well, these are the skills I want to focus on. And then based on that, it'll bring up job matches for you. So I think that's a really cool tool that we have on here as well. And for students, there's a place where students can just put in their resume as just kind of to get ready for job searching when they want to job search, and make it active when they want to. So it's kind of a nice thing for students as well. So we have kind of the both of the areas. And then we have the assistance for creating a resume, uploading an existing resume, or if somebody's looking for advice, they can click on that information as well. So,
hey, Amy, can I interrupt with a good question that came through?
sure.
If our patients or families and caregivers have issues, maybe no driver's license, no Wi-Fi, maybe some legal issues, what is your suggestion for them to maybe start this process? Would it be to call the local office and go in, or what do you think about that?
So the resource rooms in all 88 counties, you can go into the resource rooms at any time. So they're open. I think it depends on the area, but usually, 8 to 4:30 or 8 to 5, depending on the area. And the resource room, all of the computers are free. The Wi-Fi is free. They can go in there. They can use all these tools there. If they need a kind of like a different area to practice interviewing or something like that, they usually can work with the Ohio Meets Job Centers to find a just an office to kind of do that in. If they want to work with somebody, maybe they are interested in training, they can definitely go up to the counter right when you walk into the Ohio Meets Job Center and say, hey, I'm interested in, looking to get this credential or get a certificate in something, or I'm just interested in the services that you have. And they usually have kind of like a orientation type thing that they'll have individuals go through, just kind of basically do what I did in the beginning and talk about all the services. And they'll tell them about the resource room and all the services that are available. So I would just have them go into the Ohio Meets Job Center. And then we work closely with the library. So if they can't get to the Ohio Meets Job Center, if they can get to a library, it's kind of the same thing. So we try to duplicate our efforts there as well. So they wouldn't have access to the programs. That's the Ohio Meets Job Center. But if they can only get to a library, then maybe they could work something out where one of the staff members goes to the library or something like that.
Okay, thank you. Amy, thank you so much. We will share out your slides, but in the interest of time, we do have to get to Dr. Melissa Klein. I'm so sorry.
Oh, nope. Thank you for having me.
Thank you so much. Anything on jobs, we will share out. You can ask any questions. Dr. Klein, I will stop sharing if you don't mind sharing.
Yep, I will share my slides now. Can everyone see them?
It might be in presenter mode.
Oh boy. Okay, let me try again. Is that better now?
It's better. We can kind of see the next slide on the side, but we can move forward.
Okay, I'll make that smaller then. Okay. So thank you very much. I'm going to try to speed through this a little bit, just so we can get through the major pieces of it. But thank you for having me. And I'm going to talk about improving child health, really focused on food insecurity and pediatric primary care. I have nothing to disclose. I have a number of learning objectives, so including describing the epidemiology and impact of food insecurity, demonstrating primary care methods to screen for social determinants, including and focused on food insecurity. And then I have some examples of clinical community interventions that are aimed at mitigating hunger. So just to start, to kind of take a little step back, I wanted to start with a definition of social determinants of health. And this is from Healthy People 2030, which is somewhat new. And so the social determinants of health are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a whole wide range of health, functioning, quality of life, outcomes, etc. And you can see the 5 pieces that are included in the social determinants of health. I really want to remind us of Maslow's hierarchy of needs at this point, because I think we think about this often as pediatricians. And so if you see here, as pediatricians, as pediatric health providers, family medicine docs, we really focus on children achieving and children and families reaching their highest potential. However, if we don't address the issues at the bottom of the triangle or the bottom of the pyramid, our children and families are never going to reach the top of it. So it's really important to think about those things at the bottom of that pyramid, whether it's health, healthcare, food, water, shelter, housing, etc. And that really goes along with the Healthy People 2030. And then just one other aside, really thinking about equality, equity, and justice. And so these terms are thrown around a lot. And sometimes interchangeably, and they're really quite different. So equality is when everyone every individual has the same rights and resources. And so I really like this baseball field. And so you can see in the equality, there's a fence, there's 3 different children, and they all have the exact same stool. However, one child has a great view, one child is on his tippy toes and probably his legs are hurting by the end of the game, and one child still can't see. So equity is when the individuals receive the resources based on their circumstance. So their circumstance is that, is of no fault of their own or nothing they contributed to, the ground is unequal and the fence goes up. So rather than everyone get the same box, the one child got 1 box, the other child got 2 boxes, and the third child got 3 boxes. And you can now see that they all can see the game the same, and they're all in the same amount of comfort. When we think about care, we often have equal care. So everyone who comes into my office has a set of this, and we do this and we do that. And if we provide that equal care, we're actually adding to disparities. Whereas the equitable approach would be to screen for the needs of each individual family and then provide the resources that that family needs in order to be able to grow, develop, and reach their potential. We're really not talking about justice, but I think that I like this piece of it. And so justice is we take away that fence and we remove the barriers such as structural racism and other barriers that interfere with people and children reaching their full potential. So now I'm going to turn back to food insecurity and back to objective 1, which is about that epidemiology. So I wanted to start with a quote. So America is the richest country in the world. Tonight, thousands of your neighbors will go to bed hungry. Maybe your child's schoolmate who is undernourished and having difficult learning on an empty stomach. It might be a coworker, a working mother whose low-wage job doesn't make ends meet. The faces of hunger are as broad as the faces of America. And I really like this quote. It really just is from Mr. Nasny and General Mills. I think it really describes hunger and hopefully takes away some of those barriers that we're thinking about in our head. So to focus a little bit on food insecurity, it's the lack of access to enough food to fully meet basic nutritional needs because of lack of resources. It's a huge problem in America. It's a huge problem in children. There's 9 million children in the US in 2021 who faced hunger. So for those of you who haven't seen this report from Feeding America, it was very helpful. It's called Map the Meal Gap. You can easily find it. I have the link on the bottom. And it just, they had 10 key findings. I actually pulled out just a few of them. But 100% of counties have people living in them that face hunger. So for any of us who say, oh, there's no hunger in my county, that is not true. 100% of counties in America. Food insecurity among Black and Latino individuals is higher among whites in most counties. And then the childhood food insecurity rates are higher, up to 40% in some counties. I thought this was an interesting fact that people facing hunger need only $44 a month more to meet their food needs in some cases. And again, higher food insecurity rates are in the South and in rural areas, which many of us work in more urban areas. So here's, again, from Feeding America, this is a map of hunger in Ohio. And again, just to point out something that's interesting. So every county has hunger, or every county has food insecurity. But if you look at the picture over here on the right, this is the hunger in homes that have children. And you can see that anywhere there's a dark green in a home that has children in that county, which means that there's a higher food insecurity rate. If you look at homes without children on the left, it's not as dark. So this basically, though all of us care about hunger in children, all of us care about children and know that food is important. And any home that has a child in it is at a higher risk of food insecurity than just by having a child living in that home. So what does this really mean? So we're all about child health. We all want children to grow, develop, and reach their full potential. And they need many things, but there are budgetary trade-offs. So as food becomes more expensive, where's that money going to come from? Does it come from housing? Well, we know housing and utility and gas is more expensive. Does it come from healthcare, buying their medications? So families face these really difficult challenges into where does that money come from and what are those budgetary trade-offs? And everything has everyone has a reason for what they do, but all of those reasons are really tough and really tough choices. And there are consequences for the child, for the family, for the parents, etc. So we know that child hunger impacts child health. And so I'm going to just go through this very quickly. So there's malnutrition or disordered nutrition. I think more recently in the literature, we're seeing more on obesity and less on growth failure. And just know that the majority of children who are in food insecure families are still have normal weights and heights. Food insecurity or hunger impacts acute infections and poor health in both healthy children as well as in those with chronic diseases. Hunger also impacts behavioral and mental health, whether it's poor grades, achievement scores, getting in trouble, being suspended. It also impacts development, aggression, ADHD, and then suicidality, anxiety, etc. So hunger impacts all across the medical and mental health spectrum. So those are all grim realities and things that hopefully aren't new to anyone on here. So the next step is, so what do we do about this? And this takes us to objective number 2, which is demonstrating some of the social determinant of health screening. And I'm going to focus on food insecurity. So for those of you who may or may not know, so this is iHelp. This is a screening tool that was developed in 2007 by Kenyon et al. In Boston Children's. This was really developed in regard to starting a medical legal partnership. So you'll see some of these have to do more with legal needs. So I is for income and food. You can see H is for housing, E, education, legal literacy, and personal safety. Then there's the We Care study, which was We Care survey, which was also developed around the same time. This is from colleagues at Johns Hopkins. They have some different questions here. So clearly food insecurity is still in there. Housing and homelessness, et cetera, is in there, but they also add some other questions related to education, unemployment, childcare. Some of the things that I like about this one is not only do they ask the particular question, but they say, you know, if no, is this something that you want to talk about today? And then for the family who has many things that are issues or concerns in their survey, it actually asks to rank them. Because we all know in our visits, we do not have unlimited time. And so it asks to rank so that we can meet the family where they are and address what's most pressing for them. This is our tool before we went to tablets. You can see we do have food and benefits. We started a lot aligned with the iHelp, and then we added some other things related with ACEs, adding some of those things from the We Care survey. I just want to say, having a survey tool really starts the conversation, whether families say yes to certain things that they need help. It's a way to enter the conversation. But if they say no, one of the things we've learned is that there still may be issues, maybe concerns, maybe things we can help for. Our tool, we have done this in many different ways. We've asked it verbally. We had a paper questionnaire, and now we are tablet based. All of which have pluses and minuses, but the main point is really just screen. And then the Cincinnati Children's in general just changed so that all of our divisions will have the same survey. And you can see, again, there's still food, the same items are there, the questions are just a little bit different. And then I know the AAPC has an SDOH tool as well. And again, here's that same hunger 2-question vital sign. So I think if you are interested in screening, start with one thing. Food insecurity has the validated 2 hunger vital sign, which is a great place to start. It really, although the AAPC tool is it's a great tool. It doesn't matter what tool you start with. I think the main message is start and then work from there. So now that we have our screening, what do we do in our primary care center? So how do we acknowledge it? So this is just some information about where I practice. So I'm in an urban setting. You can see the majority of our families are Medicaid or no insurance at all. And then we do have some extra ancillary services, which are super helpful, including social workers, lawyers and paralegals, preschool engagement specialists, community health workers, et cetera. We're also a very large training site. So back when we first started some of our food insecurity training, This is when we used the USDA 6 question. You could see that food insecurity was quite prominent in our patient population. The biggest take homes from this is that almost a third of our households reported food insecurity within the last 12 months. It didn't mean they were reporting it that day, but they within the last 12 months had some food insecurity. And that the majority of our families ran out of WIC. And 15% of our families reported stretching their formula. And of this population, none of them had any no statistical association with growth parameters. So we started screening in our continuity clinic, in our primary care setting, and we started some interventions, and we heard that screening is difficult. We did some qualitative work with some of our physicians and residents, and we heard lots of barriers that families don't want to admit it. There's not enough time. Time clearly comes up a lot. There were some myths about families that were receiving SNAP and WIC didn't need to be screened because they were okay. And then this like, well, what do I do if I find someone, what do I do? How do I help? Why would I screen? Why would I open Pandora's box? I'm afraid to even get into that. So again, we then met that need with creating several different screening curricula to train clinicians, one on how to ask, but then what's the next question? When a family says yes to this, what do you ask next so that you can get them to the right, either in clinic or community resource? And through some QI work, through some training, we were able to increase the day of food insecurity screening positive rate from 1% to 2% to 12%, and it's maintained there for a while. So at this point, I want to transition to some of the work that we can do working with our community members to once we've implemented screening, we acknowledge what's happening. And so now how do we assist and work with and help our families to get the help that they need? And this is aligns with that objective number 3. So the way we looked at it is we thought about the risk assessments and what do families come in asking for? What are those family needs? And I highlighted food insecurity because that's what we're talking about here, but you can see there's a lot of other potential needs. And then we looked at them along Maslow's hierarchy of needs, and we try to hit the things at the bottom of the triangle first. So let's discuss like food insecurity, public benefits, utilities, housing, et cetera. And then we really looked at our community to see who in the community is experts. We are experts at childcare. We know families come into our clinics to see us, but we are not experts on food or housing. And so who in our community is, who can we partner with and collaborate with? In the next few minutes, I'm just going to talk about 2 organizations that we've worked for a long time and deeply with. So the first is our food bank. It's a large food bank in our region. They're really interested in child hunger, but clearly have limited access. Babies and infants don't go into a food bank, but they do come to our clinics. So related to that infant formula issues and many of our children on WIC, we developed a program aimed at infants, which is around infant formula. And you can see that outcomes wise, we now distribute about 80 cans a month of formula. We've distributed over 6,000 cans. We've also looked at what does this do? Importantly, we know a can of formula is a Band-Aid, but how does this help kind of that larger picture? And those children who received KIND had higher risks, which we were not surprised with our social screen. However, they were more likely to come back and get their preventative services. They were also more likely to get other services. So higher percent were referred to both social work and our medical legal partnership. With some of this data, the KIND has spread to 10 other sites in our area and continues to grow. One of the big lessons learned that we learned through all this is clearly we know WIC is supplemental. We've changed how we ask the question, knowing that families do run out of WIC supplied formula. And we very readily recommend the use of generic formula because it's similar in nutritional value, but clearly half the price and helps families stretch their food dollar. The other piece that we did as a secondary project with our food bank is created embedded pantries. So you can see some pictures of our pantries. They are really large closets with shelves. But since we opened our pantries, you can see our data here. So we have provided food for over 12,000 individuals in our community, and that includes 8,000 of our children who come to our clinic. This is just the food from the one clinic that the one primary care setting that I work in. We try to annotate to try to think about what's happening in the community, COVID, summers, et cetera. So there's a lot more detail in here, but I think it's just really about the impact that we can have. We also hear a lot, and I appreciate the conversation and the presentation before me about public benefits. We know that Jobs and Family Services is a great organization in Ohio, but there are definitely some barriers, and some of our families face challenges. Like that challenge that was put into the chat as well. And so we many of our families do get public benefits and do qualify for public benefits, but they have challenges. And so again, we worked with our medical legal partnership. So one of the main things that they focus on is public benefits, and then housing and education, which are three of the main needs in our community. And again, just some outcomes. So our medical legal partnership has intervened in over 10,000 referrals. And right now through COVID, our referral rates are higher than ever. As you can imagine, there's a lot of educational issues. There's a lot of housing issues. Food is expensive. Benefits are stretched. And so we now have about 90 to 100 referrals per month. And you can see some of those other outcomes. And then the last organization I wanted to plug is the United Way. They're a great partner for all of us, and they serve families with lots of different needs and have lots of different available resources. And so this clearly takes a team for what we have done, and I'm happy to answer questions. And I will stop sharing.
Thank you so much, Dr. Klein, for sharing those really good resources. I know we have pulled some local resources and put them online, and most of our target counties and our border counties that are participating do have a United Way branch. Are they a phone call away for maybe the families that need something?
Yeah, so the United Way is an excellent way to connect families. Families can call themselves. They just call 211 and they're connected to a counselor or a social worker who can connect them to the resources needed.
Great. Dr. Klein, thank you so much for the information. Amy, thank you so much. Zainab, thank you for your help today. Thank you everyone for joining. I will be sending out additional information, and have a good day. Thank you.